Hello, my name is Jessica Philpott, and I'm going to demonstrate how to properly test for an ACL tear. I'm going to first start by telling you a little information about the anterior collateral ligament, or the ACL. The ACL can be torn by twisting of the knee, bending it backwards or hyperextending it, or bending it side to side. The ACL is a ligament that runs from the femur, which is the thigh bone, this bone, or the tibia, which is the shin bone, and it is protected by the patella, which is the small bone that is called the kneecap. The ACL keeps the femur and the tibia in line with one another to keep the body balanced. There's going to be three ways that I'm going to demonstrate how to test for an ACL tear, and the first one that I'm going to demonstrate is called the drawer test. So I'm going to have the patient bend her leg at a 90-degree angle, which is a 90-degree angle between the femur, the thigh bone, and the tibia, the shin bone. And I'm going to sit on her foot to stabilize the leg. And then I'm going to put my thumbs in the knee joint, and I'm going to put my hands behind the knee to stabilize the knee in itself. So when I sit on the foot, stabilizing the leg, putting my hands on the knee is stabilizing the knee joint itself. And the ACL keeps the femur from sliding forward, so away from her body. If the ACL is torn, then it will slide forward. So what I'm going to do is I'm going to pull back, trying to get the femur to slide, or the tibia to slide forward. So I'm going to pull back. There's no give in the knee, so her tibia did not slide forward towards me. So it indicates that there is no ACL tear. But say I was a physical therapist and I really thought that this patient had an ACL tear. Then I would go on and perform the Lockman's test, which is a second form of indicating if there's an ACL tear. So now I'm going to have her bend her leg at a 20-degree angle from the femur to the tibia, and I'm going to place my right hand on the tibia and my left hand on the femur. The right hand is going to stabilize the tibia, left hand is stabilizing the femur, and I'm going to move my hands in this motion, pulling the tibia towards me, trying to get it to slide forward, and pushing the femur back towards her. And to check if there's an endpoint. If there's an endpoint, then there is no ACL tear. But if the tibia gives and slides forward, then there is an ACL tear. So I'm going to push down the femur and pull back on the tibia, and she has no ACL tear. Another way to test is to do the pivot shift test. This is the most challenging test to perform, and most physicians go to this one at a last resort. So the way I'm going to do this normally can be tested positive for an ACL tear if the patient tore their ACL by twisting of the knee. So what I'm going to do is I'm going to grab her ankle, which is the distal end of the tibia. Then I'm going to put my knee right underneath her knee, which is the proximal end closer to her of her tibia. And I'm just going to rotate it, twist it, rotate it up towards her, and rotate it back now. And that's how you test for an ACL tear with the pivot shift. This tests for the tibia to rotate. And during a twisting of the ACL, that would tear it. The tibia would be able to shift and rotate. ACL tears are becoming more and more common throughout the years. And for every athletic event, ACL tears are skyrocketing. In 2009, there were 223 NFL ACL tears. And then in 2013, there were 269 ACL tears. I personally had 2 ACL surgeries. So with this, it makes me very interested, and that's why I plan to become a physical therapist. And for an ACL patient or a physician that's going to test for an ACL patient, they need to be able to perform these 3 different types of tests because every patient is different in which they might react differently. Or the muscles might fire and make the leg not give, so you might have to resort to other types of ACL tests. So that's 3 ways to test for an ACL tear, and there you go. Now you know. Thank you.